Okay, go ahead.
So our assignment was to do our presentation on professional member organizations in the healthcare industry. And this was done by Amy Hokanson, Erica Summers, and Kayleen Wells. The first question was the differences between professional organizations and advocacy organizations. There's a significant difference in the roles and functions of professional organizations and advocacy organizations. We're to identify those that pertain specifically to professional organizations. So advocacy organizations influence the public opinion by using social media, research, and other methods to bring awareness to a specific policy, where professional organizations are generally nonprofit and are created to increase its credentials and improve the career of members. Many organizations will provide opportunities for career improvement and other services to help members. They will provide resources for professionals to continue education, improve and update their skills. It creates more ideas to be explored and improve the profession.
Okay, and these are the next point is the professional organization. And as a healthcare administrator, there are 3 different organizations: the AAHAM, American Association of Healthcare Administrative Management; ACHE, American College of Healthcare Executives; ACAA, Healthcare Administrators and Association. Healthcare financial managers have their own organization as well, and that's the Healthcare Financial Management Association, and that's the HFMA. They go down. Physicians have their own. They have 3. ACP, American College of Physicians; AMA, American Medical Association; AAP, Association of American Physicians. The Ambulatory Surgery Center and Administrators, the ACA, Ambulatory Surgery Association, and then Ambulatory Surgical Centers of America. Medical Group Practice Administrators are A, Medical Group Management Association, excuse me, the AFMA, Association of Family Medicine Administration, and the PAHCOM, Professional Association of Healthcare Office Management. And within these organizations, they all have their own benefits of why people join. And when I first start with the healthcare administrators, to join the AAHAM for valuable educational and support and career support. They'll help you increase your professionalism, improve your skills, and enhance your knowledge with eligibility for certification with professional and executive certifications. Demonstrate your knowledge and proficiency to your own employers and your peers. They'll enhance your career and network with your peers. To join your local chapter, there are 32 local AAHAM chapters across the nation to choose from. Joining one of these local chapters helps you to gain an edge by being kept up to date on the most recent developments in your local area, and providing you with a great chance to network with others in your area. You'll also be able to stay informed on the keep on top of the latest regulations and guidelines affecting patient and county matters through the AAHAM's publications. These subscriptions are could be through the Journal of Healthcare Administrative Management, rated #1, one of the #1 benefits of this professional organization. And by joining these, you also get discounts on products and services. The benefits of the healthcare financial managers: you can become certified healthcare financial professional. With this certification, it provides a broad range of business and financial skills necessary to succeed in today's healthcare environment. And there's two types shown on the screen. There's two types of different certifications that will help you become a better financial manager within the healthcare. And then also the physician's benefits, just like many other of the professional organizations, you join a network of peers who share your vision, you share your ideas, practice resources, improve your practice with the help of ACP, and that's the American College of Physicians, clinical support, treat patients effectively, and you also are educated efficiently to meet the requirements and keep your knowledge up to date. Then, did I go to this? Okay. Then the last group is medical group practice administrators. The PHCOM recognized the ever increasing need for a program that would provide recognition to individual office managers having knowledge, skills, and experience necessary to successfully manage today's ever-changing medical practices. As a result, the Certified Medical Manager program was established. The CMM is the designation of a true professional and is the most senior in the industry. Our focus is strictly on managers of solo provider and small group physician practices. CMM is not an entry-level certification and does not require both experience and education. The mission of the PHCOM Certified Medical Manager CMM program is to provide medical managers with documentation of their competency in the administrative management of medical practices. The CMM credential provides documented to physicians, medical boards, the public, that the PHCOM certified individual has been tested under strict requirements using psychometrically determined processes and be confident in the administrative management of healthcare organizations.
For trade organizations in the healthcare industry, the main purpose of a group purchasing organization is to negotiate lower prices on medical supplies when hospitals.
Sorry, really quick, Haley,
Yeah, I
can I
don't
get
know why
you
it's
to mute
echoing.
your microphone?
What was that?
Can I get you to mute your microphone? We're getting some feedback through your microphone.
Yeah.
Yes, I can do that. Excuse me.
Oh no, sorry. Go back into the right there. That works.
Okay, am I good to go?
Yep, go ahead.
Okay. The main purpose of group purchasing organizations is to negotiate lower prices on medical supplies. When hospitals, ambulatory surgery centers, nursing homes, etc., come together as a GPO, a manufacturer is willing to sell items at a lower price due to the promised volume of purchase. These organizations also participate in advocacy with legislative and other groups to ensure fair practices in the open market. They educate members about healthcare products and often offer assistance with financial services, among other benefits. Some GPOs, like the American Orthotic and Prosthetic Association, which serves approximately 1,900 members, serve a smaller group of medical providers in a specific specialty. Whereas the largest GPO in the United States, Novation, serves over 2,900 hospitals and over 22,000 additional members, which represents almost 90% of products purchased by healthcare organizations. And there's our resources.
Awesome. All right. Great job. Cover the topic really well. There's a lot of interesting things about professional organizations. I'm a member of the American College of Healthcare Executives, and it's definitely a beneficial group to be a member of. They do a conference every year, and I'm able to go to that and do some networking, get to know people, get some training. So it's very beneficial. But yeah, as I mentioned earlier, I'm going to ask each of you what the most interesting thing was that you learned as you were studying this topic. And so we'll just go ahead and start with you, Amy. And then after Amy, Kayleen, if you just want to answer as well.
Okay.
I think the most interesting thing to me was just how many there are, both professional organizations and trade organizations. I was surprised that not only are there the nationwide organizations, but there are also ones that are specific to each state.
Mm-hmm.
And so there's an infinite number of organizations that you could be a member of, it felt like. Anyway, it was hard to narrow it down and choose just a couple per category.
Right. There's a lot for sure.
One thing I've learned was that each, I guess, organization has their own, and there's multiple, and each of them kind of try to have different benefits, but a lot of them have similarities of their benefits depending on how you're associated in that organization. I had no idea there were so many, like Amy had said, and I had no idea that I have some experience of, like, my father-in-law, he was a dentist, so he was part of a dental organization, and he went to a lot of conventions and stuff, and he got discounted things as well, supplies and stuff for his practices. So I was like, oh, so this is how it began. I thought it was mandatory, but it's not mandatory. It's also by choice. It's more beneficial for those that want to join, but I don't really see why someone wouldn't join. But I think it's personal preference as well.
Yeah.
So
definitely. Awesome. Well, thank you both so much. I'm going to go ahead and stop recording, but hang on for just a minute.